Hello everyone, I am Dr. Suma Rao, a dental practitioner from Chennai. Over the last 6 months, the coronavirus pandemic has gripped the world. Especially for us dentists, it is a matter of great anxiety because every patient who sits in the dental chair is not wearing a mask. As the evidence of airborne transmission of the coronavirus increases, the use of the N95 mask becomes very critical. But every time I wear the N95 mask, I have a lot of apprehensions in my mind. Am I wearing it right? Will I get infected, or worse still, will I carry the infection back home? So today's video is all about the proper use of the N95 mask. The CDC, that is the Center for Disease Control, and the NIOSH, which is the National Institute for Occupational Safety and Health, are the governing bodies which lay out rules and recommendations for the proper use of the N95 mask. The N95 masks belong to the category of FFP2 class respirators. FFP standing for filtering face pieces. The filtering face piece respirators are defined as tight fitting and disposable filtering devices which are designed to filter out airborne droplet nuclei less than 5 microns in diameter up to 94%. In different countries, these FFP2 respirators are known by different names. In US, it is called as N95. In China, it is KN95. It is P2 in Australia and New Zealand, DS in Japan, and Korea First Class in Korea. The N95 masks have got the advantage of less filter penetration, less face seal leakage, and less inward leakage. You first wash your hands with soap and water or use a hand sanitizer to clean your hands. Then cup the mask in the palm of your hands with the fingertips towards the nose metal strip. Let the headbands or the straps be left dangling free. Place the mask firmly over your face. Put the upper strap over the crown of your head and the lower strap to the nape of your neck. Use fingers from both the hands to adjust this area of the mask so that the mask adapts well to the shape of your nose and creates a good seal in this area. The lower strap should be in direct contact with the skin of your neck. If you have long hair, kindly put it up. Otherwise, the seal may be compromised in this area of the mask. Moreover, putting up your hair will help you in wearing the head cap easily later on. Even the presence of a beard or a small stubble can interfere with the seal in this region of the mask. While doffing the mask, remember to take care that you do not touch the outer surface as this may be contaminated. Wash your hands clean with soap and water or use a hand sanitizer, and then remove the lower strap. Follow it up with the upper one. Holding the N95 mask by the straps alone, now you can dispose it off. Some of the N95 masks also come with expiratory or exhalation valves. Now, the exhalation valve in a mask makes it more comfortable for the wearer to breathe, less humidity and less fogging of the goggles. But currently, the N95 masks with valves is not recommended simply because the unfiltered air which comes out of the mask can spread and cause airborne transmission of the virus. Seal fit is crucial to ensure the specified level of protection by the mask. According to the ECDC technical document, a fit test with an indicator aerosol should be performed before the first time use of any model or size of the mask. and if it is positive, a different size of the mask should be tried and the fit check performed again. The simplest way to check the fit of the seal in this area is to blow into the mask. The mask should expand, and when you take a deep breath, the mask should stick against your face. Whenever there is a leak in this area, automatically your glasses will also get fogged when you blow air into the mask. Now, in such a situation, you have to readjust the seal along the nose and this area of the face so as to get a proper seal. Now, if you feel that there is air leakage in this area, you can adjust the lower straps and make it a little tighter. Again, repeat the fit check. If you feel that the air is still leaking out, it is necessary for you to change the mask and use a different size. Are you planning to reuse the N95 mask? The US CDC recommends the use of vaporous hydrogen peroxide, moist heat, and UV germicidal radiation as methods to decontaminate the used mask. But a definite no for the use of microwave irradiation, autoclave, bleach, or the use of soap and water, as this is known to affect the filtration performance of this N95 masks. CDC has certain recommended guidelines for reuse too. They have introduced two terminologies. One is extended use and the other one is limited reuse. Extended use refers to the practice of using the same respiratory protection for more than one patient without removing the PPE between the patients. And experience says that the extended use of an N95 mask could be for a maximum of 8 hours. Of course, the extended use could be dictated more by the hygienic concerns rather than the actual number of hours. Limited reuse means you wear the mask today, store it according to the guidelines, and then use it on another day. You have 5 N95 masks. You wear the mask on day 1, store it in a breathable paper bag for the next 4 days and wear it on day 5. Say you have used the N95 mask today and you want to store it and reuse it on another day. Remember that the outer surface of the mask may be contaminated with the virus, so you should not touch it at all. First, wash your hands with soap and water or use a hand sanitizer. Wear gloves, and then without touching this surface of the mask, pull the lower strap out and then the upper strap. Hold the mask by the headbands or the straps. Carefully slip it into a clean, breathable paper bag and store it in a designated place. Reuse of the N95 mask is indicated only if the fit of the mask is not compromised, or if you find that the mask is soiled or damaged, kindly discard the mask immediately. During disposal, remember that these masks may be handled by sanitation workers, hence it is our moral duty to protect them also. Please put these used masks in a sealed cover and then put it into the dustbin. Thanks to the coronavirus pandemic, there has been a sudden increase in the demand for N95 masks worldwide, and hence a lot of fake respirators are now available in the market. According to the National Institute of Occupational Safety and Health, a fake respirator is one which is marketed and sold without the NIOSH approval. So the following points will help you to identify whether the respirator is a fake one. A fake respirator will usually not have any markings written on the respirator or on the headbands. it may not have the symbol of NIOSH written on it, or if NIOSH is written, it may be misspelled. The mask may not have any TC number, which is the number of approval by the NIOSH, or sometimes the number that is written on it may be fake. You can counter check it in the NIOSH website and see whether the manufacturer has actually got the approval for this N95 mask. The N95 mask also does not come with any decorations or sequins. Some of the manufacturers claim that N95 masks have got the NIOSH approval for use for children, which is totally wrong. And finally, some of the fake respirators may have loops instead of headbands or straps. So please be careful when you are selecting this mask. So my colleagues and friends, I hope you found this video very useful. Please like and subscribe to my channel. It will mean a lot to me. Share this video with your colleagues so that they also can stay safe during this coronavirus pandemic. And for your information, in the same channel, there is another video on the use of masks for the general public, so that you can share that video with your family and friends. So until I see you next week, here's signing off, Dr. Suma Rao. Thank you.